presentation, there are two barcodes that I'm going to be passing around. You just need to scan the barcode, and that will take you to a YouTube channel that's more like a supplemental video to what she's presenting tonight. Dr. Ngozi.
Thank you so much. I want to say thank you to AMPA and Namia USA for having me speak today. So I'm going to keep it very short, but it's going to be very helpful as well. So I'm going to talk about dementia and how to prevent or reduce the risk of dementia. So it's going to be a real quick presentation. So the good thing I'm going to be presenting is the new update from the Lancet Commission on dementia risk reduction. So before we start, we need to know what it is and what causes it. So dementia is basically a very complex disease, but it's global cognitive decline, and it affects an individual's activity of daily living. So that person becomes impaired in so many areas. Mentally, physiologically, they lose their memory, they don't remember people, they don't know how to take care of themselves, they make financial mistakes, they make banking errors, and it's a big problem in America. About 57 million people with dementia in 2019, and the number is going to triple by 2050. So what do? We're getting older. What causes dementia? You know, when we hear dementia, most people say Alzheimer's, but there are other causes of dementia. Even though Alzheimer's is the most common, we have other dementias like Lewy body dementia. I don't know if you guys know this Nigerian actor called Jacob, and then there's this Lewis, I think is his name. He's got Lewy body dementia, and then you also have vascular dementia, and you have frontotemporal dementia. So many causes of dementia, not just the Alzheimer's that we know. So now I want to jump into the actual prevention of dementia, prevention of the risk factors. So one of the risk factors is hearing loss. If you have someone, especially an older person who has hearing loss, you want to make sure they get a hearing aid, because the fact that they can't hear can actually predispose them to having dementia. Education. So the more educated you are, you protect yourself against the risk of having dementia. Why? Because when you have all this education, you develop what is called cognitive reserve. So your brain capacity is really full. So if you say you have 100% brain capacity and you develop some dementia and you lose about 20%, you will still be able to function at 80%. But if you have 30% cognitive reserve and you lose 20%, you're down to 10%. It's definitely going to impact the way you live your life. So that's the second thing, it's your educational level. And that educational level really needs to be started at an earlier age. So you want to encourage people to pursue education. That is very important. Then you have the cardiovascular risk. So the whole idea is you want to reduce vascular damage in the brain, because in the brain you have the brain cells, you have the vessels. So you want to reduce vascular damage. So, you know, I call them the Three Musketeers. Who knows that movie, the Three Musketeers? You have the hypertension, you have the diabetes, and you have the high cholesterol. So this year, 2024, the Lancet Commission for Reduction of the Dementia Risk has added 2 factors into how to prevent dementia risk. And the 2 factors are vision and your cholesterol, the bad cholesterol called LDL. So what they're saying, if your cholesterol is high, you have more risk of inflammation in the brain, and that can lead to dementia risk. And also, if your vision is poor, older people with cataracts, they need to have those cataracts taken out so that the vision doesn't affect them. So we've covered those factors. We'll talk about smoking. Smoking is a big problem. We know it causes inflammation. Obesity, you want to keep your body mass index under 30. And then you want to treat depression. So depression has been linked with causing dementia. You want to be more physically active, which is exercise. exercise. You want to avoid excess alcohol. And then you also want to avoid what they call traumatic brain injury. So this is injury that occurs when someone has head trauma. So for instance, if they fall, they hit their head, or they're in an accident, they hit their head, or they're in a competitive sports. So they are saying that people who are in competitive sports should try to use helmets because you want to reduce brain inflammation. So that's the whole idea. You're trying to reduce stress, you're trying to reduce inflammation, you're trying to reduce the risks to the brain. And also, lastly, is to prevent social isolation. So they've done studies that have shown that people who are socially isolated, that is people who live alone or don't engage with friends, families, and they don't have weekly activities, they are more prone to having dementia. So those are the 14 factors. I'll go over them quickly if you want to make a note of them. I've also passed around a link to a video where I interviewed a geriatrician and she specializes in memory and dementia. You can listen to that video, it's 2 parts. And if you didn't get a scan, just come to me, you can scan and take you straight to the video. So we talked about hearing, blood pressure, smoking, obesity, depression, exercise, diabetes, alcohol, traumatic brain injury, social isolation, vision impairment, high cholesterol, and there was one more thing I forgot, which is air pollution. So apparently air pollution has been linked with increasing the risk of dementia. So we should all be advocates for clean climate and green environment. So that's all. If you have any questions, let me know. Thank you for listening.
Thank you so much. Before I let